Welcome back to my channel. Today I have Dr. Russ Van Maele back with us for another topic. Today we're going to do a deep dive into GLP-1s, the new weight loss drug. We're going to break this up into a few different conversations, and today we're going to focus on who might be a good candidate. If you watch my channel recently, about a month ago, I interviewed Dr. Sean Murphy, who is an ER physician, and him and I discussed our concerns with the drug, him seeing the negative side effects that are rolling into ERs, and me clinically seeing patients downstream while I try to strengthen them. But it's good to look at all perspectives, so it's a great honor to talk with Dr. Van Maele today, who actually prescribes these drugs to patients sometimes. So, Dr. Van Maele, who is the type of person that might want to consider this drug?
Sure. And I like to prefer calling it a peptide because it is something that we secrete naturally on our own. It is something that is prescribed, but at the same time, we are producing these things. That's why I love peptides in general. But like with anything that you prescribe, there's a reason we prescribe it because there's a right person to prescribe to and a wrong person to prescribe to. And I think in general, a lot of the people that we do prescribe to have a true GLP-1 deficiency. And when we give this to them, they have great side effects of losing weight. They feel better, they're taking weight off their joints, and their risk of a lot of these chronic diseases and cardiac diseases is going down. So that's a huge benefit, especially for that person that has never been able to lose weight. There's so many of those people that have tried every single diet you can think of. They've tried every exercise regimen and they just can't do it. Now, is that a failed diet? Is that a willpower thing? At the end of the day, it really doesn't matter because just losing only about 10% of that body fat is huge for when it comes to the lowered risk reduction of all these diseases that we encounter that have to do with metabolic syndrome. So I think there is a very much a right person for this. And technically the criteria that we're using right now is based on BMI, which I'm not a huge fan of, but we use a BMI greater than 30, that's an automatic, and then greater than 27 with a comorbidity of metabolic syndrome, which can be anything from prediabetes, type 2 diabetes, hypertension, dyslipidemia, PCOS. There's a lot that can kind of get thrown in that category of metabolic syndrome.
And like you said, just to share the context of, how you work with patients, I know just from speaking with you before, you always advocate for diet and lifestyle changes first. So
Yes,
just to be clear, this is not your first line of defense. This is okay, this didn't work. Let's try this instead. Is that correct? Or
absolutely.
how would you describe
Absolutely.
that?
Yes, I think diet and exercise will always be king when it comes to being healthy because it's the most natural approach and it's the best approach for longevity. I see a big problem in people that are, say you get a person that has a BMI of 32. They meet the criteria for starting this medication. They give it a go. They use it for a few months. They lose their weight and then they come off of it without making any of these dietary lifestyle changes. They're not exercising. They're not eating healthy. They're still doing the same things that they were doing. Those people might be worse off than the people that didn't do it at all because they're going to lose weight, but they're going to gain it all back and some, which could be a big problem for those people. And then you go into the mental side of things, the mental health, right? They have now failed another weight loss medication.
Right.
A
So
big problem as well that I'm seeing too is with these people that are just, let's call it a short-term fix. I want to lose a few pounds. Or even you could put this in with the people that want to lose 100 pounds. This stuff is expensive. And you are committing to a lot of finances over 6 months, over the course of a year, because supply and demand is low supply, high demand right now. So the prices of these medications are very high. And a lot of people are having a hard time even finding them in general just due to the shortages. So I just let people know like, hey, it's not just like we give a few shots and it's over. This is a big commitment.
So how long do you think someone should be on it? Like a lot of doctors are like saying, this is a drug for life. Do you agree with that? Or tell me maybe a better way to ask is, let's talk about maybe a success story you've had with a patient and how long were they on it, or are they still on it?
Sure. Well, I think there can be success stories of people that have been on it and stay on it, and then have been on it and then come off of it.
Okay, fascinating.
Everybody's genetics are a little bit different, and everybody's going to truly grasp the diet and lifestyle changes with it. So, we have a family friend that had a wedding just a couple of months ago, and she started semaglutide or Ozempic about 3 months prior to her wedding. And she was able to lose 20 pounds before her wedding, which was great. She was very happy. She fit into her wedding dress like how she wanted to. And she actually stopped the medication and has been off of it now for about 2 months and hasn't gained any weight back because she's got that motivation now to exercise. She has that motivation to want to make healthier lifestyle changes. And I would call that a success story because we got short-term weight loss and it's been persistent. Now you hope that she doesn't revert back to her old ways,
Right.
but I would call that a success story.
Okay, yeah. So she's adhering to these like diet and lifestyle recommendations that
Sure.
you're really passionate about educating patients on.
Absolutely. And then you got the other people that, so say they want to stay on it for life. I think that that can happen. People have to have that conversation, or you have to have that conversation when you're prescribing it to people that, hey, this could be a forever thing, and you have to be okay with that. Because what happens, and how I typically like to prescribe these, is say you have a BMI of 30 again. So they meet criteria just based on weight alone. You can prescribe it and you try to use the minimum effective dose. You can get all the way up to 100 units of semaglutide, which is about a 2.4 milligram dose. So you're basically, if you have an insulin needle like this, you're filling it up all the way. So when you punch it, you're pulling all the way. That's a lot of that medication. I like to use a lot less, and I'd rather use that in combination with dietary and lifestyle changes in order to use the minimum effective dose. And that's generally my rule for any medication. If we have to use a medication, use it as least amount as possible and have diet and lifestyle be your foundation. So going back to that patient of the obese patient that started on it, that has to continue on it, we get to that maintenance dose so they lose weight, and now we don't want to wither away and have them lose everything. So we get them to a point where they can lose weight and then we plateau. And that plateau is kind of the tricky situation. We got to find that dose where they're not continuing to lose weight, but they're also not gaining weight back. And the hope is that they adopt the lifestyle changes that we kind of coach them along the way.
Right. So I think the unique thing about you, and you work for LifeForce, which you and your colleagues are really passionate about, again, diet and lifestyle, as the go-to first thing to try, first line of defense. What I'm seeing clinically is even in an area where people have the best doctors in one of the major cities of this country, there is no conversation about diet and lifestyle. I ask these patients, so what was the conversation like about protein intake? And they're like, well, what do you mean? Like, I was just told that this would be helpful for me to be on for life to manage my weight. I didn't know that I might lose lean muscle mass. I didn't know that I was supposed to really, mitigate the potential loss of muscle mass with strengthening and protein intake. And that's what concerns me clinically. People just continuing to eat their regular standard American diet, and then we're throwing a drug on that we don't really have long-term human data on.
Yes.
So when you prescribe this to a patient, can you tell us like the specific diet and lifestyle tips that you do recommend to mitigate the potential lean muscle mass loss
Yeah.
associated with this drug?
Yeah. So the first thing I start with, and I do this for every patient to build that foundation, because that foundation is what every single person can benefit from diet and lifestyle or diet and exercise changes. So the first thing, and I think we talked about this on our first chat, was my number one rule is don't drink your calories. So I'm drinking black coffee right now. I've got my water bottle next to me, but there's no calories in that. And I don't think that drinking your calories is a very healthy thing to do. And even I would apply this to any sweetened beverage at all. It doesn't matter if it's 0 calories. If there's a sweetness to it, you really shouldn't be drinking it. So that's my first rule. And then my second rule is you better know all the ingredients of everything that you're eating. And this takes more of just, hey, I'm going to read the label and I can read what the ingredients are, but actually being able to look at your food and have it be a whole food. So that's very, very important. And then my subcategories under that are no processed foods, no seed oils, and no grains. So that is a very blanket statement that fits 99% of people, will make them healthier.
Okay, so I mean, that really sets the stage for if they do decide to come off this drug because they think they can handle it, they already have a plan in place. Okay, I should continue to eat this way to maintain that weight loss that, I was able to get from this drug.
Yes, and that alone will, if you have somebody eating the standard American diet and they truly switch over to that diet, they're going to lose weight in general. And that's what I want to encourage people to know, that you can do this on your own if you truly adhere to that. Because a lot of the times I hear this from people, or I tell this to people, and then their follow-up calls, it's like, all right, did you do that? And they're like, yep. And their labs say otherwise. So then you kind of pry a little bit more and you find out the Starbucks with the pumps of salted caramel or whatever is still going into their body. But then they're frustrated because they haven't lost weight. It's like, no, you really need to adhere to these rules, and it's going to be better for you for the long term. Yeah. So that's a great foundation, I think, to build off of. Then getting more into the specifics of lifestyle of exercise, we talk about strength training, because what you just mentioned is protein and muscle wasting. You are losing everything, and it does not discriminate. When you drop your caloric intake with these medications, with these peptides, you are losing not only fat, but you're losing muscle, and really you're losing bone mineral density too. And I think that takes a lot longer to develop clinically, but it's happening. If you're at a caloric deficit, a drastic caloric deficit, and you're just kind of wasting away, it's pulling from everywhere. And I see that as a major, major problem, especially in the people that are already at risk, like postmenopausal women going on these GLP-1s and not having the conversation about lifestyle and strength training. They're going to be at major risk for osteoporosis, which the morbidity and mortality data on that is alarming.
Right. I mean, it's a huge reason why I'm so busy and generally have a wait list to see patients, because of falls and fractures from this issue.
Yes.
So that is another concern of mine. But I guess in the context of this modern diet that is terrible and tempting every one of us every single day, I do see your perspective that this is maybe just one tool to help us while we solve the bigger issue of how did we get here? Like,
yes.
Why do we have garbage food at every corner, right?
Yes, absolutely. You have to. I wish I had like a contract with people that you are going to change your lifestyle. You're going to change the foods that go in, and you have to commit to strength training as well, and just exercise. Getting these people to exercise too. The initial weight loss will help them get motivated. Because if you have an obese person that's never exercised, it's hard for them to just say, hey, one day, they're not going to do a HIIT workout tomorrow. You have to get some weight off their joints, off their ankles, off their knees, off their hips, in order for them to almost get going. And that in itself can be a major motivator, but you have to make sure that you're not losing that muscle mass. Because I say to my patients all the time, muscle mass is the key to longevity.
Absolutely. And like you said, for everyone, that's like a good recommendation for everyone. I work with a lot of patients who have elective joint surgeries, like total hip and total knee replacements.
Mhm.
And a concern that I've been seeing the past year is post-op, the folks that have been on this drug that haven't made the diet or lifestyle changes, and I don't think that they just did it, they didn't know. They didn't know. They didn't have that. They didn't have a Dr. Van Mealy discuss this with them before being on the drug. So
Yeah.
they're at a little bit of a disadvantage there. But what I'm seeing post-op is their knees are buckling, which is a huge concern because it puts them at risk for falling, which
Sure.
none of us want, but we especially do not want after an elective surgery because we can open up our incisions, we can fracture bone on top of having a major surgery,
Mhm.
and then we just need more help. Like I've had quite a few patients who like literally can't even get out of a chair post-op because they're so weak from all of this muscle mass they lost.
Yes.
But on the flip side, one benefit is a lot of surgeons won't even operate on you until you can lose that weight.
Yeah.
So I
Catch
don't know
22.
what the right answer is here, but for someone who is going on this drug and maybe has arthritis, for example, they lose weight, they can have the surgery because the doctor thinks that they're at a healthy enough weight to do the surgery. I think it's really, really key to couple that with changing your diet and getting strong. So that on
Yes.
the other side, when you wake up after surgery, you're as strong as you could possibly be instead of, weak from years of arthritis and then the muscle mass associated with this drug.
Yeah. I think like you can apply this to anything. Healthy, healthy things. There's a right way to do it and a wrong way to do it. And I think overall, it's a major positive for the people that need this. But with anything in medicine, there has to be a patient decision process, a doctor patient relationship where you tell them about the pros and cons and be very blunt and honest. I think we do a bad job at being honest with our patients because we don't want to either hurt their feelings or we have our own agenda and we don't necessarily we kind of say, oh, you might lose some muscle mass, blah 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 blah, and you just kind of say it under your breath. But that's a big problem. We need to make sure that people truly understand what that means, because that is such a classic example. Orthopedic surgeon wants to do a total knee replacement, and they don't want to do that surgery because that person being that obese is at high risk. They're at high risk for complications. They're probably going to be in the OR for a lot longer too, which means they're under a tourniquet for a longer time. They're under anesthesia for a long time. Orthopedic surgeons don't necessarily want to take on that risk, and that's just in the OR. Then you got
Right.
the post-op process that person is going to be much less likely to be a success story for for that orthopedic surgeon, and just in general they're not going to do as well. And
Right.
that quadriceps tendon that's holding, allowing that person to sit up out of their chair, and the quadriceps muscle is very important. But it's all the musculature around the knee, the hamstrings, the quadriceps, right, the calf muscles. If you're wasting away all of those muscles, that's going to be a major problem. And then not even to mention after post-op, you're not moving for a few days too. And when you don't move a muscle or a uh, body part, you are losing muscle.
Right.
So it's definitely a catch-22. But overall, I would say patient education is just something that needs to happen. They need to be more knowledgeable, and we need to be more realistic with people.
Yeah. Well, I really appreciate your perspective. I think it's different and it's nice to talk to someone who actually prescribes this drug, right? I've spoken with a lot of other providers who see like the downstream side effects, but like you are the one in the room with a patient who is trying to lose the weight. So your opinion is very important in
Yeah,
this conversation.
yeah, and I would say still my preference is to not use it.
Hmm.
I would much rather see somebody have longevity of choosing to eat the right foods and choosing to exercise and having that ability, because that's just going to last for a lot longer. And that's a lot cheaper, and it's going to make that person happier knowing that they could do it on their own.
Right.
So,
Well, thank you. So people who are still watching, we have a video that we just uploaded on hypertension. So if you're looking to lower your blood pressure or keep your blood pressure at the number it is right now, because it's great, please watch that video. Dr. Van Maele shares his 3 top tips for doing that. And then you and I are going to have more discussions on these GLP-1s. So,
sure.
Stay tuned. Anything else you would like to add?
No, I think just this is just another like a public service announcement to have a good relationship with your doctor and make sure you ask the questions that are on your mind. If you have I always recommend when you have questions, write them down throughout. If you know you have a call in a couple of months or an appointment in a few months, write down those questions and have a list when you go in, because I want my patients to leave more knowledgeable than when they came in and be confident about the plan going forward. And if that's weight loss, we're going to do it the right way, and we're going to do it the safe way.
Right. And, when you do bring these questions to your doctor, if they're not on board, right, with like talking to you about diet, lifestyle changes, find a new one, right? Like, this is your body. Like, you have to steer the ship. No one else
Exactly.
can steer for you. So
there needs to be a trust component there.
yeah, I mean, I wish every doctor were like you, who looked at someone who holistically and, talked about the changes they can make on their own, but that's not the reality of the modern healthcare environment in this country.
I hear you. It's a shame, but we got to do everything we can to just empower patients to take care of themselves on their own, because that would make the whole medical system much better.
Yeah. Well, thank you again, Dr. Van Maele. Not everybody has the resources to afford, speaking with a functional medicine practitioner like yourself. So this is very high value conversation to a lot of people. So I really appreciate your time.
Awesome. Happy to help.
Thank you so much. Until next time.
All right.